دكتور
يس
دكتور، بس الجدول الجديد صار محاضرتنا يوم السبت، احنا راح ناخذ الخميس يعني راح ناخذ اليوم السبت، راح ناخذ
اي طبعا اي السبت بناخذ.
تمام دكتور.
هسه اقول لكم حنبدل الجدول لانه انتوا الاحد مسوي الجدول.
يوم الاحد
اي انا ما اقدر الاحد، قلت للاستاذ محمد هسه نتفاهم وياكم اسوي السبت.
تمام دكتور، نو بروبلم.
Good afternoon. Everybody is hearing me?
Good afternoon دكتور.
الكل ده يسمعني؟
دكتور جروب سي واضح.
جروب ايوبي، كلاس ايوبي.
نعم دكتور، جروب بي ام واضح.
كلاس اي.
كلاس اي هم واضح.
واضح كل الزين. بالنسبة للمحاضرة مال الاسبوع الجاي، حاطيلي يوم الأحد، راح نسويه السبت من 2 ل 3. تمام؟ يوم السبت من 2 ل 3 السبت الجاي. انتوا تخلصون دنتال ماتيريال، تخلصون الساعة 2 من 2 ل 3 راح يصير اناتومي. مكان الأحد من 1 ل 2 لأن الأحد ما أقدر، أنا عندي محاضرات مال جامعة دولير، فراح أسوي من 2 ل 3. تمام؟ يوم السبت الجاي، فإذا عندكم محاضرة الأخرى الساعة 2 ل 3. ألو؟ دكتور ما مراد التوقيع. يوم السبت الجاي الساعة 2 ل 3. الكل سمعوني؟ راح انزل اناونسمنت همينه بعدين انه السبت 2 ل 3 المحاضرة راح تصير هالشكل، بما انه كله صار اونلاين العملي والنظري مالتكم. Okay, so we will start now today. Everybody is hearing me and everybody has the slide triangles of neck. No? الكل طالع يمكم السلايد؟
ايه دكتور.
تمام.
جروب سي
تمام. Good. Now we will start. Last week we have studied the anatomy of neck, and we have found that the neck is covered from the outside by skin, superficial fascia, and then we have the deep fascia, investing layer of deep cervical fascia. And we have seen that this contains two muscles, Sternocleidomastoid. You have the new slide now, 2 pictures in it. 2 pictures in the slide. The top left is dissection, and the below right is a schematic diagram showing the sternocleidomastoid muscle extending from mastoid process down to the sternum and to the clavicle on both slides, on both pictures. And then we have the trapezius muscle. We have studied these muscles. Now these 2 muscles, they are invested by deep layer of investing cervical fascia, enclosing them. Presence of these 2 muscles divide each side of the neck, the left side and the right side, on each side of the anterior medial line, to the left and to the right, divided into two triangles. An anterior triangle, which is the anterior bounded by anterior median line, from the base of the mandible, anterior median line, till the middle of the manubrium sternum. Then the base of the mandible and the stylomandibular ligament. This is the upper border of it, and then you have the anterior border here of sternocleidomastoid. These boundaries, they form the boundaries of the anterior triangle of the neck. So the sternocleidomastoid divides each side of the neck into 2 triangles. An anterior, which lies anterior to it, bounded by anterior border of sternocleidomastoid here, the anterior median line, and then we have the base of the mandible with the stylomandibular ligament, which is thickening of deep fascia of the investing layer of deep cervical fascia. This is the anterior triangle of the neck on each side. So you have 2 anterior triangles, one on the left and one on the right. Then you have another triangle created again by presence of sternocleidomastoid and the trapezius muscle, with the superior border of the clavicle. Here is the medial third of the superior border of the medial third of the clavicle, the posterior border of sternocleidomastoid muscle, the anterior border of trapezius muscle. The same thing here, the posterior border of sternocleidomastoid muscle, the superior border of the medial third of the clavicle, which can be felt, and then you have the anterior border of the trapezius muscle. These, they form the boundaries of the posterior triangle of the neck, posterior triangle of the neck. So presence of sternocleidomastoid muscle on each side of the neck, extending from mastoid process down to the medial end of the clavicle and manubrium sterni, divides each side of the neck into 2 triangles, an anterior triangle and a posterior triangle. So again, the 2 sides of the neck are divided into 2 triangles by sternocleidomastoid. Anterior one, it's bounded by, anteriorly it's median line of the neck, anterior median line of the neck. Posteriorly is the anterior border of sternocleidomastoid muscle, and the apex of it is the suprasternal notch. The base of this triangle is the base of the mandible with the stylomandibular ligament. Of course, is covered with the skin and platysma and superficial fascia, and then you have the investing layer of deep cervical fascia. The floor of this triangle lies the viscera of the neck. Here lies the viscera of the neck in this side, the carotid sheath with the pharynx, larynx, and the trachea. The posterior triangle. The posterior triangle, it's bounded anteriorly by the posterior border of sternocleidomastoid, posteriorly by anterior border of trapezius. The base of it is the middle third of the clavicle, and the apex is the meeting of sternocleidomastoid and trapezius on superior nuchal line. Again, it's covered by skin, superficial fascia, and investing layer of deep cervical fascia. The floors of it is the muscles of the prevertebral region covered by prevertebral fascia. So again, here is the anterior triangle, base of the mandible, anterior medial line, anterior border of sternocleidomastoid muscle. It's covered with the skin, superficial fascia containing the platysma and investing layer of deep cervical fascia. Posterior triangle bounded by posterior border of sternocleidomastoid, middle third of clavicle, anterior border of trapezius covered with skin, superficial fascia, and investing layer of cervical fascia. And then the floor of it is formed by the fascia, which is the prevertebral fascia here, covering the prevertebral muscles. Now, passing to the anterior triangle here, this is the anterior triangle. Again, the anterior triangle is divided into other triangles by presence of other muscles. A muscle extends from the digastric fossa of the mandible here, digastric fossa of mandible, pass to be attached by an intermediate tendon, a link to the hyoid bone here, and then pass backward to be attached to the groove on the medial aspect of styloid of mastoid process. This is called the digastric muscle. The digastric muscle is formed of two bellies with intermediate tendon here attached to the hyoid bone by a sling, a tendinous sling. Two bellies, anterior belly and posterior belly with a tendinous band between them. Anterior belly of digastric here and posterior belly of digastric here with the hyoid bone situated in the middle of the neck. Now, this muscle encloses another triangle above, a portion of anterior triangle bounded by base of the mandible with stylomandibular ligament, the anterior belly of digastric and posterior belly of digastric. This triangle, this is called the submandibular triangle or digastric triangle. It's part of the anterior triangle. Now next we have another muscle descending downward from the hyoid bone. This is Homo Hyoid muscle. Again, it passes deep to the sternocleidomastoid here, becomes tendinous again, and then another portion of it passes downward in the posterior triangle as the inferior belly of Homo Hyoid to be attached to superior border of the scapula. This muscle is the yes.
دكتور السلايدات ما جاي تظهر يمنا.
شنو اللي طالع يمك هسه؟
الشاشة السوداء دكتور.
شاشة سوداء شنو؟
دكتور احنا كلاس A السلايد واي يقف على triangles of neck.
هسه
قدام يتحرك.
هسه صار شنو صورتين؟
دكتور.
زين هسه صورتين؟
ايه دكتور.
تمام. Okay. So this is the anterior triangle. Now the anterior triangle is divided into other triangles by presence of two other muscles. Here, digastric formed of anterior belly arising from digastric fossa of mandible, then becomes tendinous, intermediate tendon attached by a sling to the hyoid bone, and then posterior belly pass to be attached to the mastoid process deep to the sternocleidomastoid. This anterior and posterior belly of digastric, they enclose a triangle with the base of the mandible and stylomandibular ligament. This triangle is called digastric triangle or submandibular triangle. Next, we have another muscle, which is Homo Hyoid, arising from the hyoid bone, descend downward behind the sternocleidomastoid muscle, become intermediate tendon, and then another portion of it pass downward in the posterior triangle to be attached to superior border of the scapula. This is Homo Hyoid with the superior belly of Homo Hyoid and inferior belly of Homo Hyoid. Now, presence of this muscle here in the anterior triangle, superior belly of Homo Hyoid. Here you have the posterior belly of digastric, and this is the anterior border of the sternocleidomastoid muscle. These three, they enclose another triangle here, portion of portion of the anterior triangle. This is called the carotid triangle. Carotid triangle, and in the floor of it lies the carotid sheath. This is the carotid sheath. So this is carotid triangle bounded by posterior belly of digastric superiorly. Then we have the superior belly of Homo Hyoid anterior inferiorly, and then laterally we have the anterior border of sternocleidomastoid muscle. So here we have digastric triangle, here we have the carotid triangle. Now, between the medial anterior medial line, the hyoid bone, and the anterior belly of digastric, here we have another triangle. This is the submental triangle. Submental triangle. The two triangles are continuous with each other, bounded by two anterior bellies of digastric and the hyoid bone inferiorly, forming the submental triangle. So this is the third part of the anterior triangle. Below, here we have the superior belly of Homo Hyoid, the anterior median line, and then the anterior border of sternocleidomastoid muscle. This triangle, bounded by superior belly of Homo Hyoid, anterior median line, and the anterior belly, anterior border of sternocleidomastoid. This triangle is called the muscular triangle below the hyoid bone. Muscular triangle, and contains the strap muscles, the sternohyoid, and below deep to it, sternothyroid and thyrohyoid muscles. This is called muscular triangle. So the anterior triangle of the neck is divided into four triangles: digastric triangle or submandibular, submental triangle here, carotid triangle, and muscular triangle. These are subdivisions of the anterior triangle of the neck. ستبدل السلايد عندكم؟ تبدل السلايد؟
دكتور احنا كلاس A تو يلا تبدل.
تبدل هسه انا هسه بدلت. تبدل يعني الكل. So here we have divisions of the anterior triangle. بدل تمام. This is divided by digastric and Homo Hyoid, the anterior triangle, as I said, into digastric triangle or submandibular triangle. Now, what is present in this digastric triangle? Is present inside it, is covered with the skin, superficial fascia and deep fascia, contains submandibular salivary gland, contains submandibular lymph nodes, contains hypoglossal nerve, mylohyoid nerve, and artery, with the facial vessels, facial artery and facial vein. All are contained within this digastric triangle. The submental triangle, between the two anterior bellies of digastric and the hyoid bone, with the anterior medial line, this contains submental lymph nodes, contains small veins uniting to form the anterior jugular vein, the beginning of anterior jugular vein. The muscular triangle below contains sternohyoid, sternothyroid, and thyrohyoid muscle. Deep to it lies the thyroid and parathyroid glands. Number 4 is the carotid triangle. تبدل السلايد عندكم؟ تبدل مو؟ Carotid triangle. This contains the carotid sheath, and the contents of carotid sheath, as we know from the last lecture, are the external carotid artery and its branch. Then we have the accessory nerve, the hypoglossal nerve, and superior root of ansa cervicalis, of the thyroid, pharynx, larynx, and deep cervical lymph nodes with the cervical plexus branch. This is for the branch of the anterior triangle. Now here is a picture of to show you the slide of the anterior dissection of the anterior triangle. Now there are three here. We have three pictures in this slide. the above left. This is here the anterior border of sternocleidomastoid muscle. This is the base of the mandible. This is the anterior belly of digastric muscle. Here is the hyoid bone. This is the superior belly of Homo Hyoid muscle. And deep to these is the posterior belly of digastric muscle. This is the digastric or submandibular triangle. You see this contains the submandibular salivary gland, contains these submandibular lymph nodes, contains the facial vein and facial artery lies deep. Here it emerges to pass into the face. And this is the cervical branch of facial nerve. These are contained within this triangle, the digastric or submandibular triangle. Next we have here, below is the carotid triangle bounded by anterior belly of sternocleidomastoid, superior belly of Homo Hyoid. And this is the carotid sheath that has been opened. Contains the internal jugular vein. Internal jugular vein here is the same, the external carotid artery, the internal carotid artery and the common carotid artery with the internal jugular vein. And between these, behind them lies the vagus nerve. And in the upper part is the hypoglossal nerve with the branch of the ansa cervicalis. This is the ansa cervicalis, the nerves which pass anterior to the internal jugular vein, and contains also upper deep cervical lymph nodes which has been removed from this slide. So this is the carotid triangle with its contents. Common carotid dividing into internal carotid, external carotid with the branches of external carotid. Here is the facial which passes here into the digastric triangle. This is the posterior belly of digastric from here. And then pass into into digastric or submandibular triangle. Next, we have below the muscular triangle here. This is the superior belly of Homo Hyoid. This is the anterior median line. And this contains muscular triangle, contains the sternothyroid and sternohyoid muscle. This is the sternothyroid and this is the sternohyoid muscle. And deep to them is the thyrohyoid muscle, which descends downward. Thyrohyoid, sternothyroid, and then sternohyoid muscle. Passing to the submental triangle here in the anterior aspect. The submental triangle, the floor of it is formed by the mylohyoid muscle and contains submental lymph nodes with submental artery and the beginning of the anterior jugular vein. So this is for the 4 triangles of the anterior triangle. So anterior triangle bounded by base of the mandible superiorly, sternocleidomastoid anterior border and anterior median line, divided into 4 triangles by the presence of 2 bellies of digastric muscle and superior belly of Homo Hyoid into submandibular triangle, carotid triangle, submental and muscular triangles. 4 triangles of the anterior triangle of the neck. I pass to the posterior triangle. The posterior triangle, as I said, it's bounded by posterior border of sternocleidomastoid muscle, superior border of middle third of clavicle, anterior border of trapezius with the apex directed upward, and the base is the middle third of clavicle. Now this triangle is divided into 2 portions, 2 triangles, by inferior belly of Homo Hyoid. This is the inferior belly of Homo Hyoid into a small inferior triangle, which is called Supraclavicular Triangle. From its name, supra, it means above, focal clavicle. The Supraclavicular Triangle, it's bounded by inferior belly of Homo Hyoid, posterior border of lower portion of the sternocleidomastoid, and the superior border of the middle third of clavicle. This is the supraclavicular triangle. The rest of the posterior triangle is called occipital triangle, which is larger, and this is bounded by posterior border of sternocleidomastoid, inferior belly of Homo Hyoid, anterior border of trapezius muscle. This is covered with investing layer of deep cervical fascia, and the floor of it is the prevertebral fascia covering the prevertebral muscles. Within this triangle, immersed in the superficial fascia, the superficial branch of the cervical plexus, which supplies skin of the neck and the scalp. بدل السلايد يمكن صار posterior triangle هسه زين posterior triangle, so boundaries, as we said, anteriorly posterior border of sternocleidomastoid, posteriorly anterior border of trapezius, and the base of it is middle third of clavicle. Apex is the meeting points of sternocleidomastoid and trapezius on superior nuchal line. It's covered with investing layer of deep cervical fascia. The floor is formed by the prevertebral fascia covering the prevertebral muscles. Now, next slide is the divisions of the posterior triangle. Divisions of posterior triangle is by inferior belly of Homo Hyoid, divided into occipital triangle, which is the largest one, bounded by the posterior border of sternocleidomastoid, interior border of trapezius, and below is the inferior belly of Homo Hyoid. This contains external jugular vein, posterior branch of cervical plexus, which supplies the skin, contains the accessory nerve, and trunks of brachial plexus with few lymph nodes. The supraclavicular triangle, the smallest of the two, this is bounded by lower portion of the posterior border of sternocleidomastoid, inferior belly of Homo Hyoid, the superior border of middle third of clavicle. This contains the third part of subclavian artery, suprascapular artery, subclavian vein, and lymph nodes. Here is the posterior triangle on this slide. The picture lower right. Here you see the clavicle has been cut from here. This is the inferior belly of Homo Hyoid. This is the supraclavicular triangle covered with fascia. The fascia has been not removed from here. This portion contains the third part of subclavian artery, the subclavian vein here, and contains the suprascapular artery. The post-superior part, which is the occipital triangle here, this is the anterior border of trapezius, the mid-superior border of inferior belly of Homo Hyoid, posterior border of sternocleidomastoid muscle. This floor of it is formed by prevertebral fascia, which has been removed here. This is the floor of it here. The fascia is covering the prevertebral muscles. Now the fascia has been removed to show the contents. This contains the prevertebral muscles. Don't bother yourself with their names. The scalene muscles and the longus capitis or longus cervicis muscles, but these all collectively we call them prevertebral muscles. Between them, this is the accessory nerve passing over them, 11th cranial nerve, which supplies the sternocleidomastoid and trapezius muscle. Then you have the branch of cervical plexus. Here are the cut edge, the posterior branch of cervical plexus, which are the supraclavicular nerves, the transverse cervical, the great auricular, and the great occipital nerves. Then we have between the prevertebral muscles, here are the cords of the brachial plexus, which supplies the upper limb. All these are derived from the brachial plexus, C5, C6, 7, 8. The lower four cervical nerves. So these are the contents of the posterior triangle with the transverse cervical artery. These are the contents of the posterior of the occipital triangle, which is part of posterior triangle of the neck. So this is for the posterior triangle. Now we come to the contents of the anterior triangle again, the muscles which are present in the anterior triangle. Do you have the slide of anterior triangle? Now, muscles in the anterior triangle. The muscular triangle, we said, contains the muscles, the strap muscles. We have seen that the hyoid bone in the last lecture lies midway between the base of the mandible and the superior border of the larynx. The hyoid bone, you can pick it up by your index and thumb, midway between the base of the mandible above and the larynx, the upper border of the thyroid cartilage, or the laryngeal prominence. You can move it. This is the only bone in the body which has no bony attachment. It doesn't form any joint with any other bone, but muscles are attached to it and lies freely in the anterior aspect of the neck. But this provides attachment for two groups of muscles. We call them hyoid muscles. They provide steady or move the bone and the larynx. Now I went back to the slide of the previous lecture in the surface anatomy of the neck. You see in this picture, top right is the schematic diagram of the position of the hyoid bone. Lies midway between the laryngeal prominence and the base of the mandible. Between the thyroid cartilage and the base of the mandible here. This is the hyoid bone. You can pick it by between your fingers, thumb on one side and the index. You can move it from side to side. Now this hyoid bone, it gives attachment for muscles only. It has no articulation with any other bone. So it doesn't form a joint and lies free here. It's only for muscular attachments. I come to the muscles in the anterior triangle of the neck and muscles attached to the hyoid bone. Some of the muscles are attached to the hyoid bone and pass upward to be attached to the mandible, or to the tongue. And some pass downward from the hyoid bone downward into the neck. those which arise from the hyoid bone and pass upward toward the mandible and toward the oral cavity, these are called suprahyoid muscles. Supra, it means above, superior. Suprahyoid muscles. We have studied these. If you remember, we said the floor of the oral cavity is formed by mylohyoid, which arise from mylohyoid and from the hyoid bone. From its name, it's from the mylohyoid line and from the hyoid bone, which forms the floor of the oral cavity. Then you have another muscle which we call the geniohyoid muscle, again sharing in the formation of the oral floor. These two muscles, you have seen them and studied them. These are suprahyoid muscle, together with the digastric, which is attached by intermediate tendon to the hyoid bone via sling. Again, the slice above it, we call it again suprahyoid muscle. Now, a muscle of the tongue also, if you remember, we call it the hyoglossus. This arises again from the lateral side of body and greater horn of hyoid bone to be attached, inserted into the lingual aponeurosis into the tongue, hyoglossus. So these four muscles, they are called suprahyoid muscles: mylohyoid, geniohyoid, hyoglossus, and the anterior belly of the digastric muscle. All these are suprahyoid muscles. We have studied mylohyoid forming the floor of the oral cavity, the geniohyoid also sharing in the formation of the floor of the oral cavity. The hyoglossus, you have studied it with the tongue, and then the digastric muscle here in the anterior triangle of the neck. The rest of the muscles are called infrahyoid muscles. They lie below the hyoid bone, inferior to the hyoid bone. The infrahyoid muscle. Yes. Yes. You have a question? No question? Speak, let's look at it. Now, the infrahyoid muscles, from their name, they are inferior to the hyoid bone, descend into the anterior aspect of the neck downward toward the clavicle or toward the scapula. These, they form two layers of muscles. We have seen the Homo Hyoid muscle. This is the Homo Hyoid. The Homo Hyoid arises from inferior aspect of the body of the hyoid bone, lateral aspect of the body of the hyoid bone, descend downward into the posterior triangle, forming an intermediate tendon, become tendinous, and then become muscular again to be attached to the superior border of the scapula. Formed of two bellies, superior belly and inferior belly. We have seen that the superior belly divides the anterior triangle into form boundaries of carotid and the muscular triangle, and the inferior belly divides posterior triangle into supraclavicular and occipital triangles. This is one of the infrahyoid muscles. So we have Homo Hyoid form of two bellies. Next, superficial one is the Sternohyoid muscle. From its name, from the hyoid bone, descends like a ribbon, مثل الشريط, flat muscle to be attached to the manubrium sterni of the sternum. This is the Sternohyoid muscle. Now, deep to these muscles, Homo Hyoid and the Sternohyoid, we have two other muscles arising from the hyoid bone. This is the Thyrohyoid from the hyoid bone, descend to be attached to the oblique line of thyroid cartilage, and then from the oblique line of thyroid cartilage toward the sternum, we have the sternothyroid muscle. So this is, as it is, a continuous muscle lying deep to sternohyoid, formed of two portions. Thyrohyoid from the thyroid to the hyoid bone, and sternothyroid from the sternum to the thyroid cartilage, to the oblique line of thyroid cartilage. Now these trap muscles اللي هي الانفراهايويد muscles الهومو هايويد والسترنوهايويد and the sternothyroid والthyrohyoid, all these are supplied by branches from cervical plexus from C1, C2, C3 through the ansa cervicals. They form the contents of the muscular triangle of the anterior triangle of the neck. So we have muscles in the anterior triangle. Hyoid bone in the anterior part of the neck provides, as I said, attachment for two groups of muscles. We call them hyoid muscles. Provide steadiness or move the bone and with the larynx, because the thyroid is attached to the larynx, and when it elevates, it moves with it. They are of two groups, as I said, superior, above the hyoid bone, and inferior to the hyoid bone. Suprahyoid, superior to the hyoid, and attach it to the skull, to the mandible, and to the tongue. These include mylohyoid, which I have seen, this phone mobile and stable floor of the mouth. We have studied it, supplied by the nerve to mylohyoid. Next, we have the geniohyoid, superior to the mylohyoid, reinforce the floor of the oral cavity, supplied by the C1 nerve through hypoglossal. Then you have stylohyoid muscle. Stylohyoid, this is a slip on each side, nearly parallel to posterior belly of digastric, and this is supplied by facial nerve, arise from the styloid process to be attached to the hyoid bone. Then you have the digastric, two bellies joined by intermediate tendon through a fibrous link is attached to the body and greater horn of hyoid bone. Anterior belly supplied by nerve to mylohyoid, which is from mandibular, and the posterior belly is supplied by facial nerve, because it's derived from the second pharyngeal arch. Anterior belly is derived from the first pharyngeal arch, so it's supplied by mandibular nerve. Now the infrahyoid muscles, from their name, they are inferior to the hyoid bone. We call them strap muscles, ribbon-like, inferior to the bone. They depress the hyoid bone and larynx during swallowing and speaking. Now the infrahyoid are of two groups. Superficial group and deep group. The superficial is formed by sternohyoid and Homo Hyoid. And the Homo Hyoid is formed of two bellies, superior and inferior belly with intermediate tendon between them, with the sternohyoid from the hyoid bone to the sternum. Both of them are supplied by ansa cervicalis, that's cervical nerves first to three. Then deep to them is sternohyoid muscle, from manubrium and medial end of clavicle to body of hyoid bone. Then you have the Homo Hyoid, two bellies from inferior border of hyoid to superior border of scapula, with intermediate tendon between them, dividing into superior and inferior bellies. Now the deep group is formed again of two muscles which are continuous along the oblique line of thyroid cartilage, are formed of sternothyroid and thyrohyoid. Sternothyroid and thyrohyoid muscle. The sternothyroid, posterior surface, rise from posterior surface of manubrium to oblique line of thyroid cartilage, supplied by C2 from and C3 from ansa cervicalis. Thyrohyoid from its name, from oblique line of the thyroid to the inferior border of body and greater horn of hyoid bone, supplied by C1 through hypoglossal nerve. They are both of them attached to the oblique line of thyroid cartilage, one from the hyoid to oblique line. This is thyrohyoid, and one from the oblique line of thyroid cartilage to the sternum is the sternothyroid muscle, and lie deep to the Homo hyoid and the sternohyoid muscle. By now, we have finished with the triangles of the neck. Again, the triangles of the neck, on each side of the neck is divided into two triangles by presence of the sternocleidomastoid muscle, which is a key muscle in the neck. On each side, presence of this invested by the deep cervical fascia, divides each side of the neck into two triangles, an anterior and the posterior triangle. Anterior one is bounded by anterior belly of sternocleidomastoid, anterior medial line, base of the mandible with stylomandibular ligament. Anterior triangle is further divided into four triangles by presence of anterior belly of digastric, posterior belly of digastric muscle attached to the hyoid bone, and the Homo hyoid muscle, superior belly of Homo hyoid. Divides the anterior triangle into four triangles, which are submandibular, bounded by base of the mandible, anterior and posterior bellies of digastric, is covered with the skin, superficial fascia containing the platysma, the deep fascia. And this triangle contains submandibular salivary gland, facial vessels, submandibular lymph nodes, cervical branch of facial nerve within this triangle. Next, we have the submental triangle bounded by anterior medial line, anterior belly of digastric, and the hyoid bone. The two triangles on the anterior medial line fuse with each other and form a single triangle bounded by two anterior bellies of digastric with the body of the hyoid bone below. This triangle again is covered with skin, superficial fascia, vest containing platysma with investing layer of deep cervical fascia, and contains, the floor of it is the mylohyoid muscle, and contains nerve and termination of nerve artery to mylohyoid and submental vessels with the beginning of anterior jugular vein and submental lymph nodes. The third triangle is the carotid triangle, bounded by posterior belly of digastric, superior belly of Homo hyoid, and anterior border of sternocleidomastoid muscle. The carotid triangle, covered again with skin, superficial, and investing layer. The floor of it is formed by carotid sheath, and then contains the contents of the carotid sheath, the external carotid artery, common carotid artery, external carotid, internal carotid, with the branch of it with upper deep cervical lymph nodes, vagus nerve, continuation of hypoglossal, and the ansa cervicalis of cervical nerves with the upper deep cervical lymph nodes. Lastly, we have the muscular triangle, the fourth triangle, bounded by superior belly of Homo hyoid, anterior belly of the anterior border of sternocleidomastoid, and the anterior median line. This is called muscular triangle and contains the strap muscles. The strap muscles forming two layers, the Homo hyoid and sternohyoid. The superficial layer deep to them is the thyrohyoid and sternothyroid, and this lies over the thyroid gland. This thyroid gland with the larynx and trachea. Then we pass to the posterior triangle of the neck, This is bounded by posterior border of the sternocleidomastoid, superior border of the middle third of clavicle, and the anterior border of trapezius, covered with the skin, superficial and investing layer. The floor of it is the prevertebral fascia covering the prevertebral muscles. This triangle is divided into two triangles, small inferior, which is supraclavicular, bounded by posterior border of sternocleidomastoid, inferior belly of Homo Hyoid, superior border of middle third of clavicle, covered with the skin, superficial and deep fascia, and contains the axillofacial fascia, which is the covering the subclavian artery, vein, and some lymph nodes contained within this triangle. The upper portion of the large part of the posterior triangle is the Occipital Triangle, bounded by posterior border of sternocleidomastoid, anterior border of trapezius. Inferiorly is the inferior belly of Homo Hyoid, covered with skin, superficial fascia, and deep fascia. The floor of it is the prevertebral fascia, which covers the prevertebral muscles. This triangle contains the prevertebral muscles, accessory nerve, which supplies these, and the rootlets of brachial plexus. Anybody has a question? I'm done for today. And then on Saturday from 2 to 3 o'clock, you will have next lecture.
دكتور بس مكونات الانترنال والاكسترنال جاجولار فين هذا منين يتكونن؟
Internal jugular vein, it starts from the inside the cranial cavity. Starts from there, collects blood from the brain, and then descends in the carotid sheath. External jugular is formed by the union of and posterior division of retromandibular vein, which emerges from the parotid, if you remember, together with the posterior auricular vein, forms the external jugular vein. So next time you will have on Saturday, next Saturday from 2 to 3 o'clock. We will have next lecture. If you don't have any questions, then I will leave. You can leave now because I have a lecture for the first year.